Bună ziua, bun găsit la DocPlay. Eu sunt Elena Oceanu și astăzi vom discuta despre medicina modernă, medicina secolului 21, care se axează pe prevenție și pe detoxifiere. Alături de mine l-am pe domnul dr. Peter Molleney. Good afternoon, Mr. Peter.
Good afternoon.
And thank you for accepting our invitation. Today you are the CEO and founder of Vegamed, a German company who launched a new concept regarding innovative methods of scanning and therapy using medical devices. Can you please tell us more about your medical experience and the moment you decided to integrate the complementary and integrative perspective to your medical knowledge and practice?
Yeah, in the past I was a professional soccer player. I've played in the second division. Then I studied conventional medicine, and during my study I shifted to complementary medicine. I learned chiropractic, osteopathy and other things. And then I was still very close to the sport, but never we have analyzed for sportmen. And so I worked for a company in the south of Germany as medical head. And in 2007 I bought this company and all the rights, and then I started to develop own things and own concepts.
How did all start? How did you choose to develop new medical devices and introduce them to your German clinic practice and
I work in
other
in
countries?
my own clinic, and you have your experience with your clients, and you see often that you are on the limit with the conventional way. And so I was thinking, what is the best you can do for your client? So then I check some items at home, and then I give it to my technique, and then I ask them if they can develop a device that other people also can follow my ideas. The basic of the machines, for example, for the diagnostic is bioimpedance. So we are sending electric stimulation from A to B, and we measure how much of the electricity can pass. If the electricity cannot pass, there is something wrong in the system. In case we have more electricity than I have sent, I have an inflammation. So, and this is totally different from the conventional view, because in the conventional view I check if something is broken, and if it is not inside of the norm, I say you are sick. If it is inside of the norm, I say you are healthy, but that's wrong. I only can say you are not sick.
Can you explain us more about the machine you use for this?
We have
techniques?
inside of the concept we are using different machines. So one we are using is for the diagnostics. So this is the Check Medical, and in 8 minutes we are doing a fully body scan to check how is the regulation opportunity of the body, and the most important we need to know is how is the detoxification capacity of the organs. So when I know that the organs, and this is 80% of our clients, are not working well, so then I can help the body to drain in a better way. And this is a combination of the matrix therapy and the food bath.
So this is the principle they
This
are
is
based
the concept behind. So we analyze how is the regulation behave of the body, and then in case it is not regulating on a good mood, we can help the body to come back to this physiological way.
They were scientifically proved or tested?
Of course, we are working in this field more than 30 years. We have university studies, and one study we have done here in Romania at a very famous clinic for rehabilitation. It was a study over 5 years, and we have checked more than 500 clients in this clinic, and we have documented this.
Did you think of opening a clinic in our country or a center?
I think we want to have a cooperation with an existing center, because we don't have to start something new. We only put the technology into a center which is still existing here, and then they can get a competence center, and from here we can open in different areas some small detox center which don't need always the medical advice. They only need a support of a medical advice.
Which clinic we are speaking about?
We call them detox center, yeah, and this can be run by a nurse under the control of a medical doctor. So, and here the clinic we have is what is it? The name Quantica, yeah. So we have contact with them a long time, and so That's one of the reasons why I'm here. I teach now the team how to use it proper so that you can have the benefit at last from Monday. Yeah, we can start here and then we want to spread it.
Can you share with us your sports medicine experience with two famous football teams, AC Milan and national football team of Hungary?
I was coming from the sport field from myself, and I got contact to AC Milan years ago and did some analysis on two players, and the players are not in a good condition, and I promised them they will get the injury, and after 2 months they get exactly this injury, and this was the start of developing a device especially for AC Milan for preventive of medicine, because we split the team into two groups. One was following our detoxification and other training wise, and the other one are going still ahead with the old, and after 2 months we have no more injuries in our team, and the other team was still having the same problem. And so we shifted the whole team and they win the Champions League with the oldest team whichever win. So I think it's the best repetition I can have.
Yes, true.
And now we are also in Hungary. We are in the FIFA association, so young player who get trained there, they get the check-up to see if they are stressed, to change their lifestyle before they get injuries. So it's for the preventive in sport.
And how do they have to change their lifestyle?
I think one of the main important is that you have to change your food, the way what you are drinking. Young people like to have soft drinks. There is a lot of sugar inside. Sugar is destroying the muscle function, and when you want to be a sportsman and you destroy the muscle, why you are going for exercise? It makes no sense.
Yes.
So this is one of the main topic. The other thing is how to move, because we have different organs which are related to muscles, and when an organ is in a bad condition, also the muscle is in a bad condition. So we can train over the muscle, the organ, and opposite.
What are the main areas that your medical devices cover up?
Of course, one focus is the preventive medicine. So preventive you can use on everybody, especially on old people or on young people. But when we are talking about diseases which we are getting in the clinic, in a Maya clinic, main topic is allergy, rheumatism, chronic pain, diarrhea, skin irritation.
How about anxiety, stress, sleeping problems?
Of course, this is another thing, but these are secondary things. They are not primary, because you are getting the sleepiness, because you are not able to metabolize your stress, because your kidney is producing too much hormones, and so you are not able to relax. So when I de-stress the kidney, so I can do something, and we have also one tool, it is called audio color and neurofeedback. So by this way, I train your brain to relax.
How?
Neurofeedback means you are thinking something and then you are producing EEG data, alpha, beta, delta or gamma waves. And when you are always producing alpha waves, you are always awake, you cannot sleep. So I must train you to see other waves. So when you see a color like yellow or red, it is activating your body. If you see green or blue, it is reducing your body. So to be in the forest, reduce. To be at the lake, reduce. To be in the sun is activating.
How much time do I need to?
A session is 20 to 30 minutes. And my experience is you need minimum 6 sessions to learn how to train your brain. It's not very complicated. It's not very complicated. And also we have very good experience with autism, because this was one of the reasons why I have developed the device, because a child who is living in his own world, you only can reach by sound and color.
Yes. The devices are safe to use for children?
Of course. All the devices are medical devices. They have a CE. We are very proud that we have the newest standard, which is now available on the market, which we get last 2 weeks ago.
How do they work for autism?
For autism?
Yes.
Autism, as I say, is very complicated to reach, because the children have a bad experience, and that's why they capsule into our own world. And when you play a sound, it is familiar with them. Because the mother, when they are pregnant, they normally sing a little bit or they watch TV. And so the child learns the vibration. And over the vibration, I bring the child back into the careness of the mother. So, and then I can train him to see some specific colors, and then he is able to open the world again.
Can you tell me an example of?
Yeah, we had one child. It was coming from Ghana. The father is a doctor. After vaccination, the child was autism, and I explained them that the vaccination was stressing the child because they have misused the trust and brought him to a doctor to make him sick. And we play with the music, and now after it's around about a half year, he is back to school. Nobody knows that he is autism, and the wish of this child is to study medicine.
Wow!
So that's one of the most impressive, and we are willing, we are planning at the moment to open a clinic in Africa specialized for autism.
But if we talk about detoxification process, how is working?
I think the most important is to know that detoxification is generally only saying we bring something out. But you must know that the toxins are inside of the connecting tissue. This is a structure which is everywhere in the body. And the problem is that you cannot clean it with normal things when you drink something or whatever. It is impossible. Because the information is stored like a database on your computer. And you must put a special program on it to deprogram this structure so that the toxin can move. And that's why we have a combination with the matrix therapy to mobilize the toxins and to neutralize the toxins.
And what are the steps you take for a detoxification program for a person?
At first you are doing the analyze. So then it is very helpful to advise them to change a little bit their lifestyle. In the meantime, you are doing the detoxifying with the matrix, with maybe colon hydrotherapy and a food bath, so that you have a cleansing. So then you reprogram the system, and then you have to train the people to hold the new lifestyle. And this is a process of, let me say, 4 weeks, and then normally it's done.
Do you adapt this program to the patient needs, or is?
Of course, it is always individualized. So we have the machine which is doing a standard, but the most important for the standard is we are taking the input from the client, and by this way we are using exactly his personal problems and not a problem from another client.
So the detoxification program is useful only to prevent some diseases, or is it useful for a person who has a disease already?
It is for both people. It is very useful. In case you have something, then you want to release the problem. So then it is, I think, a priority, because preventive medicine, the most of the people don't think about this. Yeah, but when they have pain, when they have allergy, they want to have something. And in conventional medicine, all our treatments are blocking the system and not bringing the problem out of this.
And in the detoxification program, how important is the person to make some changes in their lifestyle?
Of course, when you are working with the machine is doing the process of the technique. Yeah. But when you are not follow up with lifestyle changing, so then you fall back into the old disease. So that's normal. But the machine don't need at this moment the client. Yeah, we are doing the process on him, and he will see the changing. And it doesn't matter if it is doing a doctor or if it is doing a nurse. Yeah, the result will be the same. But when the client is not complaining and he follow you, then the benefit and the output is much better, double.
What are the main benefits of this detoxification program?
You are feeling fitter, that's the most important. You detoxify the body, so you do antioxidation, so that means the growing of the cells is slower, so you are not aging so fast. That's the most important. You can see directly on the skin you are looking more beauty, because when the toxins are out, so then you can see that the face is fresh. So this is what we want. So also the vitality in everywhere is coming back. So it's a general process.
Is it age limit for this, or everybody can?
No, I think my youngest client I'm doing the treatment is 4 years, and my oldest at the moment is 86 or 87. So I think there is no limit.
There are some risks involved?
No, the only risk is always the person who is operating the thing. When you are working with an electric device, you must know that there are some contraindication, but for this you have the medical doctor. But the machine himself is not doing any risk to the client, because we are working on a safety protocol, which is the highest standard in the world at the moment. Yeah, and whenever something is going wrong, the machine switch off.
Thank you for information.
Welcome.
And for accepting our invitation. Mulțumesc pentru atenție. Eu sunt Elena Oceanu. A fost alături de mine domnul dr. Peter Molleney. O zi frumoasă. La revedere!